The patient ultimately did have BRCA testing and was noted to be have a BRCA1 mutation in the germline setting, and was treated, given her no gross residual disease status, was treated with IV and IP chemotherapy with paclitaxel and cisplatin. She received a total of 6 cycles of treatment, and her imaging at the completion of treatment was completely negative, and her CA-125 did normalize to 15. There are multiple options for adjuvant therapy after the completion of upfront surgery for patients with a high-grade serous ovarian cancer. This particular patient received intraperitoneal chemotherapy, which is one of those options. There's the opportunity of doing only IV chemotherapy, and that can be given in a number of ways. One way is to give both the paclitaxel and the carboplatin once every 3 weeks intravenously. Another option is to give something called dose dense, which is when the paclitaxel is given weekly and the carboplatin is given every 3 weeks. And finally, there's also fractionated chemotherapy, where both drugs are given once a week, just to kind of spread that out and to reduce the toxicity. Now, in regards to efficacy, we've had a number of different studies get reported favoring each one of these regimens, and we're still learning as we go. It does appear that the IV every 3 weeks can remain the standard of care, and certainly is something that all patients can receive with good outcomes. However, there are some studies that indicate in a patient that you're able to achieve no gross residual disease and optimal surgery like the one this patient had, that there can be a benefit as far as progression-free and overall survival with patients that are treated with intraperitoneal chemotherapy. So that's ultimately what this patient was treated with. That's what her surgeon thought would be the optimal option. And certainly at the completion of therapy of 6 cycles, she had evidence of a complete clinical response, both by her imaging as well as her CA-125. So I would say this is an absolutely optimal outcome for this patient.